Pull up a chair and buckle up. It's the Original Strength BodCast. Hey guys, thanks so much for tuning in to the Original Strength BodCast. Got my very special guest, my teacher and best buddy, Dr. Dan Barrows, with us on the show today. And we are going to be talking about the body and how it can heal. Dan.
Yes.
Thanks for being on the show.
Hey, thanks for having me, Timmy.
So, let's talk about your body, because your body has done some miraculous healing.
It has.
Just your knee alone. Can you explain the condition of your knee and how you were, like, say, 7-10 years ago and how you are today?
Oh, yeah, for sure. So, about 34 years ago, I was involved in a car accident. And at that time, had some significant trauma and damage to the joint surfaces and the ligaments in the knee. And then over time, I've had several, actually 4 surgeries that have yielded some results. They allow me to function. But over time, my knee just got stiffer and stiffer and stiffer. And as a result, when I was a young father with my children, I had some limitations in knee flexion, my ability to kneel on my knee itself, crawl around on the floor with the children. So I had some limitations in how my body expressed itself. I still played soccer, still played some basketball. Eventually got to the point where I had to quit those because I'd play those and then I'd walk into my clinic. My knee would be swollen, I'd be limping around. It wasn't good for business to see the therapist limping around after I was doing activities. So I eventually had to quit that and then got into cycling. And through the cycling, my knee got better, but it wasn't until your course in 13 in Alexandria, Virginia, that I actually started doing some things with my knee that at first made it angry because I didn't understand the process that it was going through then. I do now, but I didn't initially. So I had some swelling and some stiffness in the knee, but in some respects it felt different, so I pursued that avenue more since I'd felt this knee for 20 plus years not being so good. Started to pursue that more and more and more. And then over time, the swelling got less and less each time I did my exercise. And pretty soon it was like, boy, the more I do it, the better I felt. So now I have what was initially a grade 3 degeneration of the joint, osteophytic formation of my knees. You can see the changes in the bone structure itself. And so recently I went and had an x-ray done because I was curious about how come my knee feels so good. I was wondering what it looked like. Because typically in our field, and your listeners may know this too, but generally arthritis is what we call a degenerative cascade. So over time, it's that a thing in motion tends to stay in motion unless it's opposed by an equal and opposite force. So typically arthritis begins and it continues down that path where you eventually have more pain and swelling, and in some cases knee or hip replacements that we see so often in our country. However, mine started feeling better and better, so I was curious to see how bad the knee looked. And went and had x-rays done about 7 months ago. And at the time, I don't have my old x-rays from 15 years ago. The people that I had it done, they changed over and they don't have the films. And however, after getting my pictures taken, they were going, yeah, your knee's not too bad. And I thought, not too bad? You guys were ready to replace my knee about 10 years ago. And so it looks on the outside just as bad. The inside, I don't know how to state the inside because I don't have the pictures that they said how bad it was and where it is now, so I can't compare that. All I can tell you is the function of it. I'm a whole different knee as a person, but I'm a whole different knee than I was, 7-8 years ago for sure.
So, and now you have grandkids, and you can get on the floor and play with them.
We race crawling. Yep. In fact, it's part of my exercise now. I can get literally on the floor. I can sit in positions I used to not be able to get into. And then the influence between the knee and my spine, the protection of the knee I had, my limitations in my low back, how I used to be able to sit, what I used to be able to get positions I get into on the floor. Again, completely different now. Yeah.
So, but you went from, hey, you're bone on bone, you're going to need a knee replacement, to, it's not that bad, and you can do what you want to do.
Yep.
How does that actually happen?
That's the $1 million question, isn't it? The society that we live in, the culture that we live in, and how we perceive the human body, I think, probably dictates some of that. But we live in a culture where, unfortunately, if we have an issue, we wait for somebody to develop a pill. And although medicines aren't wrong for things, whether it's high blood pressure or diabetes or arthritis, we have to understand it's really a myopic approach to the problem. So the solution then comes in to play what is your worldview of the body, right? So if we believe the body's restorative and has healing properties, the question is, how do I tap into that, hopefully on a regular basis, to allow that to occur? So for me, with what we would be dealing with here would be articular cartilage. The surfaces of the joint wearing out or becoming soft, or maybe a combination of both. We, through OS and doing what I've been able to do with compressing the joint, I allow, some of your people may have already heard this if they've had the course, but it's kind of like a sponge. So the fluid inside of the joint, which is primarily water, is non-compressive. It resists compression. So if I cover my bones with that when I step, pressure doesn't reach my bone, which is painful, kind of like walking on your elbow, not a good thing to do. And so if I have healthy articular cartilage, the surface of the joint, it imbibes fluid, it's resilient to compression, and I walk around in life, I kneel on my knee, I have no pain. If those are not healthy, if I don't have adequate water retention in the joint, if my articular cartilage becomes soft or degenerative, then forces that I step travel through the articular cartilage, no longer being resisted, affects the bone, then I perceive it as achiness, pain, stiffness, swelling, whatever the body chooses to respond to it. So what I've been able to do through OS and cycling and a combination of those things is to compress and decompress my joint sufficiently to maximize its ability to perform its task, which is resist compressive forces of a joint. On a side note, the pain that was generated by it also had an effect on my hamstrings, my calf, my low back, how my leg swung, how my gait looked. So just reducing the pain in the joint was fine, but then I needed to reacclimate my knee function to my ankle, to my hip, and to my spine, so that when the knee did feel better, it actually functioned better, not just felt better. And OS was able to process that whole thing together, taking it as a unit, keeping its components, and then combining the components to a functional movement of the lower extremity and the spine.
Would you say that your knee healed, or what would you call it?
Good question. I wouldn't say it's healed, because if you take an x-ray, it still has some changes in there. Mm-hmm. So, but did I optimize its function and purpose? Yeah. And I think that's what we try to do, everything. Even in our own lives, we try to optimize how we function in life, our relationships. I don't think optimizing anything is a bad thing. The question is, do we know how to do that? Whether it's in our personal life or in our physical body. That's kind of the challenge I think we have on this earth, is how do we understand it and then maximize it?
So for optimal function, you often talk about creating an optimal stimulus for the body to get the resources it needs to heal.
Yep.
What is an optimal stimulus, and how do you create it?
So the first thing, in order to create an optimal stimulus, is you have to understand what it is you're trying to stimulate. Brain cell activity, motor coordination, healing of tissues in the body, and if so, which tissue? Is it bone? Is it cartilage? Is it musculotendinous? Is it discogenic? What is the tissue that you're after to stimulate? So you have to know your histology side of things. Once you understand the histology of whatever it is you're trying to work on, then understanding what it is, then you figure out what's the stimulation. And then the critical element is the optimal stimulus, right? So too much of anything is probably not good. Too much of a good thing can be bad at some point. So finding out how to apply that stimulation to the human body, to the tissue that you're asking, is kind of the art form. It's not a straight algorithm. It's not a prescription of 3 sets of 10 for exercise. It's not a cardiovascular training of 70% of max VO2 for 25 minutes. It is being able to get in touch with your body and understand what your body's information is giving you back. And I'll borrow your phrase. It's like you get to ask your body a question, and if you listen for it, it'll give you the answer back. So teaching individuals here listening to your podcast, or in my case, patients that are in my clinic, I have to teach them not only how to ask the question, but how to interpret the answer.
Awesome. So you mentioned that when your knee was hurting, that the pain affected your hamstring, your low back, and your gait, your walk, how you walk.
Yep.
And I had a conversation with you yesterday, and you were talking about there's two types of pain.
Oh, yep, for sure.
What are those two types of pain?
I am a simpleton at heart, right? We read things in life, or have situations in life, or a book that we read, and sometimes the ideas that come to us are complex. And sometimes it's difficult trying to distill those and making those simple. So for me, I just like making things simple, whether I'm teaching at Fresno State or and you can attest this talking to my children. It's like, no, let's make this simple. Let's get it down to the bottom. So for me, I just think of there's two types of pain. Not sensations, not burning, aching, throbbing, pulsing, not description of pain, but types of pain. Pains that harm us and pains that hurt us. Hurt pain is what we probably deal with 95% of the time in our lives. We step wrong. Ooh, I felt that in my foot. You bend over. Oh man, I strained something. But life goes on and you continue to function. So the body uses that to be aware, like, if you do that a lot, or probably doing that every day, you should be aware of it. But as we go through life, that subsides. It's like me punching you right now. Ouch. You're not running to the hospital wondering if I was strong enough to break your arm and to get a cast on it. It's like, okay. Harmful pain, though, is what our clients and our patients need to understand the difference of. So there's ways to do that. Harmful pain has a couple of characteristics that I like to have my patients understand. Harmful pain is a pain that typically doesn't get better the more you do something. The more you do it, the worse it gets. So there's a kind of a little caveat that you can use. Often, more harmful pain will tend to spread. It tends to travel or radiate. It's like throwing a rock into a pond. It creates a splash. I get that. I punch you, splash, there it is. The question is, do you have ripple effects? And if you have ripple effects, it must be some kind of energy or something that's continuing to build or transfer. So if I punch you and all of a sudden 20 minutes later you go, man, I can't even lift up my arm, there may be more harmful injury there than we thought. So I use those two elements in deciding what is hurtful and what is harmful pain in kind of a guideline when I'm working with folks.
Does it have to mean injury? Or are there periods when it doesn't mean injury at all?
More times than not, it probably doesn't. Patients and our culture, I think, for the most part, either we live with some kind of dispain, whether it's physical, emotional, spiritual pain, or if we have pain that changes our way of living or thinking. Often it's usually severe. If it's not severe, we treat it as such, and because of that, it still alters all the things that we do, even though the pain itself is not a harmful pain. So I think the short way around that is I liken the idea of a paper cut for patients, because most of the time people think if I have pain, something's dramatically wrong. Well, again, depends on your worldview, right? So if we live in a world that we think is broken and that unfortunately bad things happen in it, we can't assume that every time we have pain, it's something that we need to check out. Life experiences tell us that, oh yeah, last time I smashed my finger, it hurt for a while and then I was fine, and I've learned from that. But somehow, for some reason, we have systems go haywire, and that pain then becomes something more than what we think it is, and we transfer that from a hurt pain to a harm pain. So the paper cut analogy is the severity of the pain that you feel in a paper cut, and as annoying as it can be, you can't hardly use your hand, you can't put it in your pocket. None of us rush off to find out what's wrong. In fact, half the time we're trying to find why it hurts. We're looking to see if there's a cut that we can see. again, based on the tissues that were damaged, high sensitivity, but not a tremendous amount of damage. And that goes both ways. And an example, humbling example, is a friend of mine who fell off his bike and fractured his hip, unbeknownst to me. So he came to me and said his hip was sore. I did all my tests for hip fractures, and I told him, I said, I think it's just you fell on it and it's sore. Stay off it for a week. Well, and I saw him the day of the injury. About 2 days later, apparently he went to the hospital. He had X-rays and he'd fractured his hip. So the level of pain he had, it was sore. The severity of the injury, pretty legit. Fractured hip takes a lot of force to do that, and he has a tough sense of understanding pain anyway, as he is kind of stoic. But I missed it through all my examinations. He came back in about 2 weeks later and said, yeah, he got a pin stuck in his hip. I go, what? So even when we understand it, sometimes the severity of the pain never or rarely matches the intensity of the injury.
And can people's, because of that, people can misconstrue what they're feeling.
Absolutely.
And then their thoughts can kind of run
wild
like squirrels.
Oh, yeah.
And then that can actually cause the pain to stay or intensify.
Mm-hmm.
How do you help your patients get out of those kind of cycles?
That's a challenge. I think for most of us, when we are presented with the opportunity to try to explain things to people, first of all, it helps to walk at least a half a mile in their shoe. So for me, and I deal with pain on a regular basis when I'm trying to treat it in the clinic, one of the things that I do is I try not to focus on pain. I know that kind of sounds funny because that's why they're usually to see me. My shoulder hurts. They rarely come in and say, hey, I'm having a hard time just turning my body to the left. It just feels tight, unless there's pain associated with it. So on my end, because they're so focused on the pain, we try to focus on function, mobility, and I try not to use pain in my dialogue with them. So if I have an open-ended question, so this comes in a little bit to, I think, pain behavior modification, which is a big thing in our side of the treatment in the medical side. But if I use an open-ended question, so, Tim, how are you today? I have not directed any of your thoughts. Your thoughts get to run wild. So if your thoughts are already about pain, guess what you're going to tell me? Oh, I hurt today.
Yeah.
That's right, huh? Oh, it's a horrible day. Like, it's not what I was asking. What I really want to do is I want a closed-end question. Tim, how did you do with your exercises yesterday? See, now I've narrowed it down. I didn't ask about your pain. I didn't ask about your pain the first time. But because you're thinking about your pain, that's what you're assuming I'm asking. So you have to begin to kind of modify people's thought processes. And that becomes a challenge for sure. And not always successful by any means of it. But it doesn't mean I don't try. And it doesn't mean that on occasion I get patients that understand what we're trying to do with them and understand how the thought of pain can intensify pain by the simple thought process. And that's where we're learning a ton about the brain, especially with concussions. One of the things that have come out about and through the concussion protocols that are going on with the NFL and that trickle-down effect is there's been a massive amount of study on the brain, which we never did before 10 years ago. Just kind of like, yeah, it's pretty complex, it's plastic, it does this. But now they're really starting to delve in. And so neuroscience is in my field, is all the rage right now. It's all about understanding the brain and what it does to the body, physiologically and emotionally.
So a person can break that cycle, though, of fear and pain, and then if they can get out of that, sometimes their pain just goes away without them even, because they're not focused on their pain.
Yeah, and I can't explain how that works. It's like an Etch-a-Sketch where you draw and you erase it. So we know that movement has a role in that. We know that we have a thing called engramming where when we do something over and over, we have a learned pattern. Pain travels along some of those same pathways in the brain, and way too complicated for me to explain. I just know that when I move people, I can erase that Etch-a-Sketch at times, and things just move better, and then they actually perceive pain as being less. We know that pain and fear travel the same pathways in the body and through the brain, and so I don't know what that means. It just means that our emotions are tied to it. So if I feel like I'm being helped, if I have a sense of hope, if it's instilled in me that there's hope, that there's light at the end of the tunnel, my pain can actually get less by the fact of what I'm thinking about myself and how I feel about it. So complex, but movement and what we say, the words we use, have strong impacts on the amount of pain one perceives.
So what we say in the words we use, then, can the body heal?
Oh yeah, it's designed to. Absolutely, it's designed to heal. If you're asking me if I take an old car and I restore it, is it a new car? The answer is no. Is the restored car look like new? Sometimes. Does it run better than it was before? Absolutely. So I don't know if we ever become completely new, but we restore a ton of things in the human body if we give it a chance. And so in my field, I'm all about restoration. It's all about restoring back to.
So do you think if everybody knew that, it would be helpful in their journey to overcoming whatever they're dealing with? Like if you knew your body was designed to heal and that it could be restored and maybe even function better than it did before it was hurt, could that potentially hasten the healing process?
Oh, I think there's no doubt about it. At least from a clinical standpoint, I can attest to that. I'm not sure I could map out all the science behind why that works. It just works. If that were true, your statement, my job would be made a whole lot easier. But when we look in our culture, Tim, the treatments that we get for pain are always about taking care of pain, never fixing the problem of the pain. Sorry, there's nothing we can do. You get that a lot. Sorry, we can't help you. Here's some medications. And we saw the ramifications of that in the last 4 to 5 years with this heavy dosage of narcotics and abuse of heavy narcotics use and the triplicate forms of the prescriptions that were used and limitations of all that. We see it as a result of that because we didn't understand the words that we use and the way that we live our lives and its implication on our ability to understand and to deal with pain.
So if you're listening at home, your body's designed to heal itself, and the body can heal and it can be restored. And now you've heard that, so oftentimes when you hear something, you believe it, even if it's not true.
That's right.
But that's worth believing because that's also true, which makes it twice as powerful, I think. The point of that is, though, if you get hurt or you are hurt, that doesn't have to be the end of your story.
Amen.
There's hope and you can heal.
Yep.
Better than ever, depending on where you were when you got whatever happened to you.
Yep. And I would say that the system that which you use to promote that process varies greatly. And so without being a plug for OS, for me in my clinic, I do a lot of things for people. I put my hands on them, I listen to them, I speak with them. But a equally important thing in what I do every day is what do I ask them to do to become accountable and responsible for their own well-being. And one of the biggest things I do is I give them pushing reset with exercises from OS because of the understanding of what it does to the histology of all the tissues in the body for the promotion of healing and restoration. What does it do to the nervous system and its ability to create new pathways and become plastic so that people can move in and out of pain while the body's trying to heal that which it's like picking a scab. If I have a scab and I pick it every day, I ain't gonna get any healing on it. So when we don't change how people move, they still move through the same issues and that it just never gets, and we wonder why the body doesn't heal. you haven't done all the right things yet. You haven't changed what's harming it, and you haven't done anything good for it. No wonder the body doesn't do what it's supposed to do. So I think, from my perspective, introducing OS into my practice as much as I have now has just changed the response I get through my patients, gives them more hope. They do better. I feel better because I'm helping more people.
That's awesome.
Yeah.
So then, two things. Know that your body's amazing and it's designed to heal. It's wonderfully made, and that's the first thing. Second thing is press reset every day,
Every day.
because that's actually what you're designed to do anyway.
Yep.
Dan, thanks for being on the show.
No, my pleasure. Glad to be out here in Carolina enjoying time with you.
All right, everybody. Thanks for tuning in. Hope you have a great week, and we'll see you next time. Thanks for listening, everyone. Have a great weekend.